The nurse. They couldn't silence. Hook. The blood hit the surgical drape before anyone in the room understood what was happening. 1 second, Dr. Marcus Reed was mid-incision, confident, unhurried, and the next, the patient's carotid artery opened like a split seam, and arterial spray painted the overhead light crimson. 2 senior surgeons stumbled backward. A scrub tech knocked over a tray. Someone said, "Oh God," and then nothing useful after that. Emily Carter was already moving. She didn't reach for the obvious instruments. She didn't call out for guidance or wait for permission. Her left hand found the wound with a pressure angle that nobody in that room had ever seen applied outside a forward operating base, and for 11 seconds, the longest 11 seconds of every witness's life, she held that man's blood inside his body through nothing but trained instinct and a past she'd never once mentioned. The monitor stabilized. The room was absolutely silent. And then Dr. Reed turned around and told her she'd crossed a line. Before we go any further, if this story already has your attention, I want to ask you something. Drop your city in the comments below. Like this video, follow along because I want to see exactly how far Emily's story travels. People watch from everywhere, and every city in that comment section tells me this story found someone who needed to hear it. Now let's go back to Crestwood and to the woman nobody saw coming. The morning had started the way most of Emily Carter's mornings at North Valley Medical Center started, with someone either talking past her or talking down to her, and her deciding, again, that it wasn't worth the energy to respond. She'd clocked in at 6:45, pulled her assignment sheet from the rack outside the nursing station on the surgical floor, and found that she'd been scheduled to assist in 2 elective procedures and 1 exploratory laparotomy. Standard. She poured herself half a cup of coffee from the pot that someone had made hours earlier and tasted burnt at the bottom, drank it anyway, and went to check on her pre-op patients. Room 4 was a 63-year-old man named Walter Price, scheduled for a carotid endarterectomy. He was nervous in the specific way that men his age got nervous, quietly, with his jaw set and his hands folded on the blanket and his eyes moving to the window whenever a question got too close to the thing he was actually afraid of. "You sleep at all?" Emily asked, checking his IV line, running her thumb along the tubing out of habit. "Little bit." He watched her hands. "You been doing this long?" "Few years." "You look young." "People say that." She noted his vitals on the tablet, cross-checked the pre-op checklist. His blood pressure was slightly elevated. Anxiety, almost certainly, but within acceptable range. "Dr. Reed's one of the best vascular surgeons in the state. You're in good hands." Walter Price nodded slowly, like he was deciding whether to believe her. "What about your hands?" he said. "You any good?" Emily glanced up from the tablet. Something in his voice wasn't quite joking. "I'm good enough," she said. She meant it. She just didn't explain what she meant by it, which was the same thing she'd been doing for 3 years at North Valley. The OR was cold, the way ORs always were, and Emily had learned early in her time at North Valley that the temperature wasn't the only thing that dropped whenever Dr. Marcus Reed was running a room. Reed was 51, tall enough that he had to tilt his head slightly under the overhead lights, and he had the professional confidence of a man who had been told he was exceptional so many times that he'd stopped questioning it. His record was genuinely strong. His manner was something else. He didn't greet the nursing staff when he entered. He reviewed the board, spoke briefly with his anesthesiologist, and then turned to the room the way a general surveys new terrain, with assessment rather than acknowledgement. Emily was positioned at the instrument table. She had Walter Price's file reviewed, the tray laid out in the sequence she anticipated Reed would need, and a secondary setup ready based on a slight irregularity she'd flagged in the pre-op imaging. A small calcified deposit near the arterial wall that the surgical notes had mentioned, but not, she felt, adequately weighted. She almost said something about it before the incision. She'd learned to pick those moments carefully. Reed didn't look at her during the opening sequence. The procedure moved cleanly through its first 20 minutes. Retraction, exposure, the careful work of isolating the carotid. He was good. Whatever else he was genuinely skilled with a blade, and Emily had enough experience watching surgeons to know the difference between technical confidence and performance. Reed had both, which was part of what made him so difficult to argue with. The problem came at minute 23. Emily saw it before the monitor reflected it. There was a change in the field, subtle, a slight shift in the tissue response around the dissection plane, and her brain processed it 3 full seconds before she consciously understood what she was seeing. When she did understand, her stomach tightened. "Dr. Reed," I didn't ask. He didn't look up. "The proximal Carter." He said her name the way some people said enough. Flat, final. The scrub tech beside her went still. "You are here to hand instruments when asked. Is that a difficult concept?" The anesthesiologist's eyes moved briefly toward Emily and then away. She pressed her mouth closed, watched the field. 18 seconds later, the artery gave way. It wasn't a catastrophic rupture in the traditional sense. It was more like a seam giving under pressure. The calcified plaque she'd noticed in the imaging shearing loose and the vessel wall behind it following. Arterial blood moved fast, and it moved a lot, and the sound in the room changed immediately. Monitors, voices, the particular quality of controlled panic that Emily recognized from places that had nothing to do with a hospital in Crestwood. Reed called for suction, called for a clamp. His hands were moving, but the angle was wrong. She could see it. The approach was going to make compression harder, not easier, and the bleed was already... Emily stepped in. She didn't announce it. She didn't ask. Her left hand found the correct position at the wound, proximal occlusion, thumb and forefinger establishing a pressure bridge across the vessel, while she called out to the scrub tech with her right hand extended, not looking, not needing to look. Bulldog clamp, curved. Now. And the tech gave it to her because her voice had a quality that made people hand her things without stopping to think about whether they were supposed to. The bleeding slowed further. The monitor tone steadied. Reed had gone completely still. For those 11 seconds, nobody in the room made a sound. The anesthesiologist was watching the readouts with the tight-eyed focus of someone who has just decided to pay attention. The circulating nurse had her hands pressed flat against the supply cart. Even the OR tech in the corner, who had been filling out paperwork on a clipboard, had stopped moving. Emily maintained the compression. Her breathing was even. Her hands were not shaking. She'd held pressure on worse wounds than this in worse places than this. And some part of her, the part that had spent years training for exactly this category of moment, had simply taken over without consulting the rest of her. She guided Reed's hands to the position that would allow him to place the clamp correctly. She did it without language, just contact and slight directional pressure, the way you would work with a teammate rather than correcting a superior, and Reed, to whatever credit remained available to him in that moment, let her. The clamp seated. The field stabilized. Walter Price's blood pressure, which had been in a steep and alarming descent, began climbing back toward acceptable. Reed stepped back from the table. He looked at Emily for a long moment. Something moved across his face. Not gratitude, not the complicated acknowledgement of someone who has just been saved from a serious mistake. It was something colder than that, and Emily recognized it immediately, because she had seen it before on men who had been outperformed in front of an audience. "Finish the hemostasis," he said, to no one in particular. Then he walked toward the OR doors. The scrub tech let out a breath that was almost a word. Emily went back to work. She didn't think much about it for the rest of the shift. That was a habit too. The practice of finishing what was in front of you before accounting for the fallout. Walter Price came through the procedure without further incident. She wrote her nursing notes with the specificity she always used, documenting the intraoperative event with clinical precision and no editorializing, and submitted them through the standard system. She was in the break room eating half a sandwich at 2:15 when Dr. Lena Marsh, the nursing supervisor, found her. Marsh was a reasonable woman and an ineffective manager, which was a combination Emily had come to understand as the most common kind. She sat down across from Emily with the expression of someone who had just had a conversation she hadn't wanted to have. "He filed a complaint," Marsh said. Emily put down the sandwich. "Reed filed a formal complaint against me. He's characterizing it as unauthorized clinical intervention during an active surgical procedure." Marsh said this carefully, the way you repeated something you had memorized rather than something you believed. "He's requesting a review." Emily looked at her. "He made an error in dissection approach that resulted in arterial compromise. I intervened with a temporary pressure technique to stabilize the field before a clamp could be placed. The patient is alive and in recovery." "I know." Marsh held her gaze. "I've seen the monitor records." "Then what exactly—" "Emily!" Marsh's voice dropped, not unkindly. "He's also talking to administration, and he's talking to some of the other attendings. And the story that's being constructed is—" She stopped, pressed her lips together. "It's not the same story you just told me." The break room smelled like burned coffee and someone's leftover Thai food. Outside in the hallway, a cart rattled past. Emily looked at the surface of the table. "What's the story he's telling? That you panicked, that you interfered with a controlled process, that your intervention disrupted the field and created additional risk." "That's not what happened." "I know that." Marsh looked genuinely tired. "But he has 20 years in this hospital, and you—" She stopped again. "And I'm a nurse," Emily said. Marsh didn't answer, which was itself an answer. The formal review notice arrived in Emily's hospital mailbox the next morning, signed by the chief of medical staff and co-signed by the department administrator. It was 4 paragraphs of careful bureaucratic language that meant, stripped of its qualifications, "You are being investigated, you should be cautious, and the outcome of this investigation may affect your continued employment." She read it twice, folded it, and put it in her bag. She was working a floor shift that day, med-surg, one of the quieter assignments, and she went through it the same way she went through everything, steadily, without visible disruption, cataloging what needed to be done and doing it. She checked vitals. She managed a post-surgical patient's pain protocol. She spent 20 minutes with an elderly woman named Dorothea Baines, who was frightened and alone and needed someone to sit with her while she worked through a meal tray she kept insisting she wasn't hungry for. "You ever been treated unfairly?" Dorothea asked her, around a small bite of applesauce. Emily thought about it. "Yeah, a few times." "What do you do?" "Keep working," Emily said. "Usually the work matters more than the argument." Dorothea considered this. "My late husband used to say something like that. He was in the army." Emily said, "Mine's a longer story," and left it there. By the 3rd day after the complaint, the atmosphere on the surgical floor had changed in the particular way that institutional climates change when someone powerful has decided to make an example of someone who isn't. People who had been ordinarily collegial were now cautious in her presence. Not hostile mostly, just recalibrated. The kind of social caution that said, "I don't know which way this falls yet, and I'd rather not be standing near you when it lands." 2 nurses she'd considered something close to friends stopped sitting near her at the nursing station. A surgical resident named Okoro, who had always been friendly, gave her a tight professional nod in the hallway and kept moving. Even the unit clerk seemed to take slightly longer than necessary to process her supply requests. Reed himself she saw twice. Both times he walked past her without acknowledgement, which was somehow worse than the confrontation she'd been bracing for. He had the demeanor of a man who had decided the matter was already settled. In the small conference room off the nursing supervisor's office, she sat across from the hospital's patient safety officer, a methodical man named Dunbar, and answered questions about the surgical incident for 45 minutes. She answered everything precisely and without qualification. She described the dissection error, the timing of the arterial event, the exact manual technique she had applied and why, the instrument she had requested, and the sequence of events that followed. Dunbar took careful notes. At the end, he looked up from his pad and said, "The technique you described, the proximal compression method, that's not a standard nursing intervention." "No," Emily said. "It isn't." "Where did you learn it?" She met his eyes. "I've had training in emergency and trauma medicine beyond what my nursing certification reflects." Dunbar waited, clearly expecting elaboration. She gave him none. He wrote something down. "We may have follow-up questions." "I'll answer them," Emily said, "the same way I answered all of these." Tut. The notice of suspension came on day 5. It wasn't framed as a suspension. It was administrative leave pending review completion, which meant the same thing with different paperwork. She was to cease floor duties effective immediately, return her badge to security for temporary reprogramming, and remain available for additional review meetings. She found out about it 20 minutes before Marsh was scheduled to officially inform her because the nursing station's central computer updated the shift calendar, and someone at the station noticed her name had disappeared from the next 2 weeks of scheduling. By the time Marsh found her to deliver the news, 3 people in the department already knew, which meant by the end of the shift, all of them would. Marsh delivered the notice with the apologetic efficiency of someone who wished they were somewhere else. She said the words that needed to be said. She added that it was procedural, that outcomes weren't predetermined, that Emily should contact HR with any concerns. Emily took the documentation. She signed the acknowledgement form. She went to her locker, changed out of her scrubs into the clothes she'd arrived in, and packed the small collection of items she kept at the hospital. An extra pen, a granola bar, a photograph she didn't look at now, a small worn notebook. The hallway outside the locker room was empty when she stepped into it. She walked to the elevator, rode it to the ground floor, crossed the lobby, which was going through the particular mid-afternoon chaos of a busy regional hospital, family members searching for information, a child crying in the waiting area, 2 paramedics at the ER triage desk filling out transfer paperwork. She pushed through the main entrance into the afternoon, which was gray and slightly cold, the sky the color of old concrete. She stood on the sidewalk for a moment. She thought about what she'd told Dorothea Baines. Keep working. Usually the work matters more than the argument. She hoped that was still true. Her phone rang. She looked at the screen. Unknown number. The area code wasn't local. It was a 703 prefix, which she recognized, and recognizing it made something in her chest go very quiet. She answered. Carter. The voice was male, controlled, professionally neutral. This is Sergeant Major Delgado. I'm calling from the Joint Medical Operations Office. We have an incoming situation, and your name came up in a coordination query. I need to ask you to return to North Valley Medical Center. Emily stood on the sidewalk outside the hospital she had just been suspended from. I've been placed on administrative leave, she said. I'm aware, Delgado said. That's not the concern right now. Commander Nathaniel Voss was transported to your facility approximately 8 minutes ago following a security incident on the I-48 corridor. His medical status is critical. We have a team en route, but we need you at the facility before they arrive. Her grip tightened on the phone. Nathaniel Voss. The name moved through her memory with the specific weight of someone she hadn't thought about in 3 years, but had never quite stopped knowing. What's his presentation? She asked. Delgado told her. She was already walking back toward the entrance. The ER was controlled chaos in the way that high-volume trauma departments always were. Layers of urgency moving at different speeds, the staff calibrating triage with the practiced efficiency of people who made critical decisions every few minutes. Emily came through the ambulance bay entrance, which she knew better than the main entrance, and found the department operating at elevated tempo. She could tell by the staff density near Trauma Bay 1, the clustering of personnel that indicated something beyond a standard resuscitation. She didn't have her badge in working order. She had her suspended employee ID in her pocket, which technically still had her name and photo on it, and she had the kind of walk that people who needed to ask questions didn't usually have. She reached the trauma bay door without being stopped. Through the narrow window, she could see the patient, male, mid-50s, broad-shouldered, the kind of physical presence that was still apparent even horizontal. She could see 2 ER physicians and a trauma resident working the resuscitation, and she could see from the body language of the resident and the way the attending kept making small adjustments to a protocol that wasn't producing results, that they were working the wrong tree. She recognized the presentation. She recognized it the same way she'd recognized the arterial problem in Reed's OR, not from formal analysis, but from a deep and specific archive of experience that she had spent 3 years trying to keep locked away in the back of her professional life. She pushed through the door. "Who are you?" The attending, Dr. Patricia Hearn, according to the ID on her coat, looked up sharply. "Emily Carter, surgical nursing, 5th floor." The suspension hadn't been broadcast ER-wide yet, or Hearn didn't have the roster in front of her. "I need you to look at his secondary presentation. Left lateral chest wall, the intercostal spacing. I have a resuscitation in progress. He has blast pattern pulmonary contusion with delayed hemothorax onset." Emily moved to the side of the bed, not the head, not the position of authority. just the position where she could see what she needed to see. The BP drop isn't cardiac in origin. His breath sounds on the left are already diminishing, and you're going to lose the window for a thoracostomy in about 4 minutes. Hearn stared at her. The resident was already reaching for a stethoscope, moving to the left lateral position, and Emily watched his face change as he listened. The very specific change of a clinician who has just heard something that confirms a hypothesis he wasn't expecting to confirm. "She's right," he said. His voice was tight. "Left lateral breath sounds are—" The monitor shrieked. Voss's blood pressure cratered. The telemetry showed a rhythm that Emily had seen before, in conditions that had nothing to do with a hospital in any American city, and her hands were already moving, reaching past the resident for the equipment she needed, calling out supply requests in a sequence that Hearn, to her credit, to her genuine professional credit, began filling without pausing to ask how a floor nurse knew the order. Outside the trauma bay through the window, Emily was dimly aware of a change in the ambient noise of the ER department. It wasn't the usual noise. It was something lower pitched. It was the particular percussive beat of rotor wash, heavy rotors, military weight, not a medevac chopper, and it was coming from the direction of the hospital roof. She didn't stop what she was doing, but she knew what it meant. 12 minutes after she'd walked back through the ambulance bay entrance, the door to Trauma Bay 1 opened behind her. And the ER, which was loud in the specific way that emergency departments are always loud, went completely silent in the way that emergency departments almost never do. Emily didn't turn around. She was holding a thoracic line in place with the flat of her palm, watching the pressure numbers on the monitor begin their recovery, counting the seconds between readings with the quiet arithmetic of someone who had done this kind of math before and knew exactly where the margin was. "Carter." The voice was behind her. It was not Sergeant Major Delgado's voice. It was someone with more authority than a sergeant major, and it was addressing her with a familiarity that had nothing to do with her job at this hospital. She kept her eyes on the monitor. "Give me 30 seconds, she said. The numbers hit the threshold she'd been waiting for. She made 2 small adjustments to the line position, called out 2 follow-up instructions to Hearn's resident, and then, and only then, she took her hand off the patient, stepped back from the table, and turned around. The man standing in the doorway of the trauma bay was wearing duty uniform, not battle dress, which meant this was official and not operational. He had the posture of someone who had spent decades doing something very specific with his body. Behind him, in the corridor, Emily could see 2 additional figures in the same uniform, and beyond them, the pale frozen faces of the North Valley Medical Center ER staff, watching something they didn't have the context to understand. She looked at the man in the doorway. He looked at her. "Colonel," she said. "Sergeant Carter," he said. And then, very slowly, in full view of every stunned face in that emergency department, he brought his right hand up to his temple. It was a salute. Emily stood in the trauma bay, suspended, stripped of her badge, professionally erased by a man who had called her a nurse like it was a verdict, and she did not move for a moment, just looked at the colonel, at the salute, at the faces behind him. Then she raised her right hand in return. The heart monitor behind her kept its steady rhythm. Nathaniel Voss, commander, was alive. The salute held for 3 full seconds before the colonel dropped his hand, and the ER corridor behind him stayed quiet in a way that emergency departments were structurally not designed to be. Dr. Patricia Hearn was the first person to find her voice. She said, "Someone want to explain what's happening?" Not really as a question, more as a statement about the category of experience she was currently having. And nobody answered her immediately because nobody in the room had an answer that would have made adequate sense. The colonel, his name tape read Whitmore, and Emily knew the name the way she knew the 703 area code from a place in her memory she'd kept deliberately unpacked, stepped fully into the trauma bay, and let the door close behind him. He was 60, maybe 61, with the kind of face that had been weathered by a specific variety of sustained stress and had come out the other side looking less like age and more like compressed material. He looked at Voss on the table. He looked at the monitor numbers. Then he looked at Emily. "How bad?" he asked. "Stable for now," she said. "Left hemothorax from blunt force thoracic trauma, secondary to what looks like close-range blast overpressure. He's got bruising consistent with being inside a vehicle when something detonated near it." He needs a CT of the chest to confirm the extent, and he needs to be in an ICU within the next hour. Can this facility handle that? She almost said they suspended me this morning, and then didn't, because that wasn't the question he'd asked. Yes, if the ICU attending is brought up to speed correctly. Whitmore nodded once. Behind him, through the door's narrow window, Emily could see one of the uniformed figures. A woman, junior rank, carrying a case that Emily recognized by shape, speaking to someone from hospital administration. The administrator had the look of a person who had arrived expecting a simple coordination conversation and was rapidly revising that expectation. "You saved him," Whitmore said. "Hearn's team was here before I was," Emily said. "I redirected the diagnosis." "Carter." He said her name the way people said it when they meant stop doing that. "You saved him." She looked at Voss. She looked at Stantz. His chest was rising and falling with the regularity of someone who had made it past the worst of something, which didn't mean he'd made it entirely, but it meant the numbers were trending in the right direction. She had a complicated history with Nathaniel Voss. Not bad exactly, not good in the conventional sense, just the kind of complicated that accumulated when you spent 18 months in operational conditions with someone and then went separate directions at the end of it. "He saved me once," she said. "Balance of accounts." Whitmore didn't ask what she meant by that. The next 40 minutes were the kind of controlled confusion that happened when two institutional systems, a civilian regional hospital and a military coordination unit, were trying to operate in the same physical space without a pre-existing protocol for doing so. Whitmore's team moved with the organized efficiency of people who had been in unfamiliar buildings under time pressure before. And Hearn's staff moved with the organized efficiency of people who were very good at their jobs and deeply confused about what was happening, and the intersection of those two types of efficiency produced a lot of brief, pointed exchanges in hallways and over the nursing station counter. Emily moved between them as a kind of unofficial interpreter because she understood both languages. She got Voss's chart annotated with the additional trauma indicators she'd identified. She walked Hearn's senior resident through the specific follow-up monitoring he'd need to watch for. A delayed pressure change in the left pleural space was still possible, and the resident, whose name was Farrow, was sharp enough to absorb the information without needing it repeated. She coordinated with the radiology department to flag Voss's CT as priority and explained briefly and without elaborating on her suspended status that the order was coming from the attending on record. She was in the middle of reviewing the CT request form when Dr. Marcus Reed walked into the radiology hallway. He was still in his surgical attending's coat, and he had the expression of someone who had heard something that required his personal presence to assess. He looked at Emily. He looked at the form in her hand. He looked at the soldier standing 2 feet to her left, one of Whitmore's people, a staff sergeant named, according to his tape, Okafor, who was there functionally because Whitmore had told him to stay near Carter without explaining why to anyone who might ask. Reed's jaw tightened. "You're on administrative leave," he said. "I'm aware," Emily said. She didn't stop reviewing the form. "That means you don't have clinical authority in this facility. Whatever you're doing." "The order is under Dr. Hearn's name," Emily said. "I'm consulting, which I believe doesn't require my badge to be active." "Consulting." Reed said the word like it tasted wrong. "On what basis?" "On the basis that the patient in Trauma Bay 1 needed a specific diagnostic protocol, and Dr. Hearn requested input." She handed the form to Okafor, not to Reed, partly because Okafor was the one who'd be taking it to radiology, and partly because the look on Reed's face when she handed paperwork to a uniformed soldier instead of him was something she allowed herself that one small satisfaction. Reed took a step toward her, not a threatening step exactly, but a closing of distance step, the kind that was meant to reclassify a conversation from professional to personal. "I don't know what you think is happening here, Carter, but this doesn't change anything. The review." "Dr. Reed." The voice came from behind him, and Reed turned. Colonel Whitmore was standing at the end of the hallway. He had not raised his voice. He was not in an aggressive posture. He had simply appeared, the way men who spent careers understanding terrain had a habit of appearing at the point in a corridor where his presence would be most evident. "I don't believe we've been introduced," Whitmore said. He walked toward Reed in a way that was courteous and somehow did not feel courteous at all. Colonel Daniel Whitmore, Joint Medical Operations, Defense Health Agency. And you are? Reed straightened. The training of 20 years of institutional authority told him to respond to a formal introduction with one. Dr. Marcus Reed, Chief Attending Surgeon, North Valley Medical Center. Dr. Reed? Whitmore stopped at a distance that was professionally appropriate and said nothing else for a moment, which was a technique Emily recognized from a very specific category of interaction. He was letting the silence do something. Ms. Carter's involvement in the stabilization of Commander Voss is a matter of record that my office will be documenting. I'd encourage you not to interfere with her ability to complete that consultation. Reed's face went through several things. He landed on stiff professionalism. I'm not aware of her qualifications in whatever. No, Whitmore said pleasantly. I don't imagine you are. He looked at Reed for another moment, the look of a person completing a thorough and efficient assessment, and then he turned back toward the ER wing and walked away. Reed stood in the hallway. Emily went back to the radiology request. Voss's CT was completed by 7 in the evening. The imaging confirmed the left hemothorax and added a new finding, a small but significant hepatic contusion that needed monitoring, the kind of secondary injury that got missed in the initial chaos of trauma management when everyone was focused on the most immediately dramatic problem. Farrow caught it on the scan, read and flagged it without prompting, which Emily noted with something close to professional satisfaction. She spent the hour after the CT standing in the ICU consultation room with Whitmore and a woman she'd been introduced to as Dr. Gail Tran, the military physician who had come in on the second helicopter and was now coordinating Voss's ongoing care with the ICU team. Tran was thorough and technically strong, and she and Emily moved through the handoff with the efficiency of two people who understood the same framework without needing to establish it from scratch. His prognosis, Whitmore asked, when they'd covered the medical review. 48 hours will tell us a lot, Tran said. The hemothorax is managed. The hepatic contusion is the watch item. If he doesn't develop additional hemorrhage in the next day and a half, his recovery path is reasonable. Whitmore absorbed this. He had the particular stillness of someone who had been getting difficult medical updates for long enough that he'd learned not to react to them in the immediate moment. All right, he looked at Emily. I need to talk to you, he said, not about Voss. They found a vacant family waiting room at the end of the ICU corridor. Small, 3 chairs, a table with a coffee machine on it that had an out-of-order card taped to the front. Whitmore sat. Emily sat across from him. Tran stayed in the doorway, not quite inside, which was its own kind of courtesy. How much trouble are you in with this hospital? Whitmore asked. Emily considered whether to minimize it, decided not to. A formal review that's likely going to result in termination. The surgeon I assisted during an intraoperative emergency filed a complaint characterizing my intervention as unauthorized. He's been building the case with administration for 5 days. Whitmore looked at her steadily. And the intervention itself? Saved the patient's life. There are monitor records and OR documentation. She paused. The patient's name is Walter Price. He's in recovery. He doesn't know how close it was. But you do? Yes. Whitmore was quiet for a moment. Outside, in the ICU corridor, a nurse rolled a medication cart past the door with a sound like distant weather. Why didn't you contest it harder? He asked. You have... He stopped, chose a different route. Your record isn't something a civilian review board would ignore. My record, Emily said, is classified to a level that a civilian review board wouldn't have access to, and I didn't want it accessed. I left the service to be a nurse in a hospital, Colonel. Not to be... She stopped. I just wanted to do the work. Whitmore looked at her for a long time. The look wasn't critical. It wasn't without understanding. It was the look of someone who recognized a choice they'd seen other people make and had never quite understood, even while respecting it. That may not be an option anymore, he said. She didn't ask him what he meant. She already had a preliminary answer, which was that when military officers showed up at the hospital where you'd been suspended and saluted you in front of the ER staff, the information architecture of your private life had experienced a significant breach. The question wasn't whether her past was going to surface. The question was the form it would take. She went back to check on Voss at 9:30. He was conscious, marginally, the specific quality of consciousness that was close enough to sleep that the line was theoretical. And she sat in the chair beside his bed for a few minutes, not because there was clinical reason to, but because she'd been in rooms like this before, on the other side, and she remembered what it felt like to wake up and find people nearby. He didn't speak. She didn't need him to. After a while, she got up and left. In the ICU corridor, she ran into Hearn, who was coming off the end of a long shift and had the look of someone who had been doing a lot of internal processing and was ready to externalize some of it. "I'm not going to pretend I know what's happening," Hearn said, "but I want to say, the diagnosis you made on Voss, the presentation sequence you identified, that wasn't standard emergency nursing. She wasn't accusatory. She was direct in the way that good physicians were direct when they were trying to understand something." "Where does that come from?" Emily looked at her. Hearn was sharp, fair-minded, had run the resuscitation with professional composure even after Emily had redirected it without introduction or authority. She'd earned a partial answer. "Places I don't usually talk about," Emily said. Hearn took this in. "Are you going to be okay with the review? With—" She gestured vaguely toward the ER end of the building, which was a gesture that meant read without saying read. "I don't know yet," Emily said. "Probably depends on the next few days." Hearn nodded. She looked like she was going to say something else and then didn't. She went toward the elevator. Emily watched her go. Her phone buzzed. A text from Sergeant Major Delgado, who had arrived at the hospital 2 hours ago and was somewhere in the administrative wing. "Need you in the conference room off the main lobby. Now, if possible." She went. The conference room was the kind of institutional space that existed in every hospital. Drop ceiling, oval table, a whiteboard with something half erased on it from a meeting weeks ago, a smell that was half recycled air and half old coffee. What was not standard was the number of people in it. Delgado was there. So were Whitmore and Tran. There were also 2 people Emily didn't know. A woman in civilian clothes who had the precise posture of someone in law enforcement or federal service, and a man in a jacket that was expensive enough to be intentional, sitting with a legal pad and a pen. At the head of the table, looking like he'd rather be somewhere with a higher altitude and a better view, was a man Emily hadn't seen in 2 years, General Raymond Krause, who ran the Defense Health Agency's operational division, and whose presence at a regional hospital in Crestwood on a Wednesday night meant something was happening that was significantly larger than Nathaniel Voss's hemothorax. Emily sat down in the chair that had been left open, which was directly across from Krause. Nobody had told her which chair to take. The open chair was the obvious one. "Sergeant Carter," Krause said. "I've been a civilian for 3 years, sir," she said. "I know." He wasn't being dismissive of the correction. He just also wasn't adjusting his usage. "We'll call you Ms. Carter if that's your preference." "It is." He folded his hands on the table. He was 67, white-haired, with the kind of institutional weight that had nothing to do with rank insignia and everything to do with the number of difficult decisions a person had absorbed over decades. Emily had worked under his oversight twice, operationally, and what she remembered about him was that he didn't use words to fill space. "The situation outside the city this afternoon was not random," he said. "The attack on Commander Voss's vehicle was targeted. His convoy was hit with precision-placed explosive ordnance, which indicates foreknowledge of his route. The woman in civilian clothes, federal, definitely, Emily could identify the category even without the badge, shifted slightly in her seat. The investigation is ongoing," Krause continued. "What I can tell you is that Voss was carrying documentation pertaining to a federal audit of several healthcare contractors operating in the Mid-Atlantic region. That documentation is now with our investigative team." Emily's attention sharpened. She kept her face still. "There's a secondary element," Krause said. "The audit Voss was carrying materials for. It includes a flag on North Valley Medical Center, specifically on procurement practices, billing irregularities, and a pattern of internal complaint suppression going back approximately 4 years. The man with the legal pad wrote something. Emily looked at Krause. "You're telling me this because the name that appears most frequently in the internal complaint suppression documentation is Dr. Marcus Reed," Krause said. And because your complaint, the one he filed against you, is now part of a federal evidentiary record. The conference room was very quiet. He's been doing this before, Emily said. It wasn't a question, but Krauss answered it like one. The pattern suggests at least 6 instances in 4 years where Reed suppressed or discredited complaints from nursing and support staff. 3 involved clinical outcomes that were documented internally as unfavorable. 2 of those patients filed civil suits that were settled quietly by the hospital's legal team. He paused. There is also documentation suggesting that Reed had advanced knowledge of the federal audit timeline. Emily thought about the timing of the complaint, filed the same day as the OR incident, the speed of the administrative response, the particular determination Reed had shown in pushing the suspension through a process that normally took longer. He was cleaning house, she said. That's the current theory. Krauss looked at her, which makes your presence here considerably more relevant than a question of surgical jurisdiction. She sat with this for a moment. Across the table, Whitmore was watching her with the careful attention of someone who already knew the answer to the problem and was watching to see if the person who needed to arrive at it was going to get there. "What do you need from me?" she asked. "Your documentation of the OR incident, the monitor records you referenced in your review meeting, your nursing notes." Krauss paused. "And your willingness to provide a formal statement to the federal investigative team." She looked at the woman in civilian clothes. The woman, reading the look correctly, said, "Special Agent Renata Kowalski, HHS Office of Inspector General. We've been running the audit for 8 months. How much did you have before today?" Emily asked. "Enough to be confident, not enough to be conclusive." Kowalski was direct, which Emily appreciated. "The documentation Voss was carrying closes several significant gaps. Your testimony, given the specific incident you were involved in, closes the last one." Emily looked at the table. She looked at her hands. She thought about the whiteboard in the corner with someone else's erased meeting notes. She thought about the break room and Dorothea Baines and her applesauce and the half-drunk cup of bad coffee she'd started the day with, and the suspension notice and walking out of this building onto the gray afternoon sidewalk, thinking about whether the work still mattered more than the argument. "Okay," she said. She said it simply, without ceremony, because that was how she made decisions. Kowalski's team worked through the night. Emily gave her formal statement in 2 parts. The first covering the OR incident in clinical detail, the second covering what she had observed of Reed's pattern of conduct over 3 years of working in his department, which was a longer conversation than anyone in the room had expected. She was precise. She didn't editorialize. She gave them facts in the sequence they'd occurred, with dates where she had them and approximate timelines where she didn't, and Kowalski's team recorded everything and asked follow-up questions that told Emily they already had corroborating material they were choosing not to share with her yet. At some point after midnight, Delgado appeared in the doorway of the conference room with 2 cups of coffee from somewhere, which were hot and recent and not from the conference room machine, which meant he'd made a specific effort. He gave her one without comment. She drank it. Around 1 in the morning, Kowalski's team asked for a break to review documentation, and Emily stepped into the hallway. It was the particular quiet of a hospital at night, attenuated but not absent, the persistent hum of machinery and the occasional movement of staff who were always there, always working, in the hours when visitors went home. She went up to the ICU. Voss was awake, not fully, his eyes open when she came in, which was different from the metabolic half-consciousness of a few hours ago, and he tracked her movement to the chair beside the bed. He said, with the rough economy of someone for whom speaking was currently effortful, "I heard the helicopters." "That was for you," she said. "Figured." He closed his eyes briefly, opened them. "You're in trouble." "Less than I was this morning." He made a sound that was the minimum possible version of acknowledgement. "Whitmore told me about the OR situation." A pause. 4 days and you didn't call anyone." "It wasn't a military matter." "Carter." The same inflection Whitmore had used. "Don't be stupid about which resources you have." She looked at the monitors. His BP was holding. Respiration was regular. The hepatic contusion numbers were stable, though they needed to stay that way for another 24 hours before anyone could use the word cautiously. "I wanted to handle it myself," she said. "I know." He turned his head slightly toward her. You've been doing that for 3 years. I left for a reason. I know that too. He was quiet for a moment. It was a good reason. I'm not arguing about the reason. He shifted slightly, and the adjustment was clearly uncomfortable, and he masked it with the same practiced efficiency he masked most things. I'm just saying, you're not completely alone. Emily looked at him. Nathaniel Voss, in a hospital bed in Crestwood, with a chest tube and a bruised liver, and the specific look of a man who had said more about the current situation than he'd initially intended to, looked back at her. I know, she said. And then, because it was true, and the night was long, and she was tired in a way that had nothing to do with sleep. Thank you for sending Delgado. Delgado called me, Voss said. I'm in the system as your emergency contact. She blinked. You're still in my emergency contact. Apparently no one updated the paperwork. The edge of his mouth moved. Government bureaucracy. Works in your favor occasionally. She almost laughed. It came out as something quieter, something that was the bones of a laugh, without the sound. She sat with him for a while longer, until his eyes closed again in the less effortful way that indicated genuine rest rather than managed consciousness, and then she went back downstairs. Kowalski's team resumed at 2 a.m. and ran until nearly 4. By the time Emily walked out of the conference room for the last time that night, she had a formal status as a cooperating witness in an active federal investigation, which was not how she had anticipated the week going when she'd clocked in on Monday. She also had, waiting for her outside the conference room door, Dr. Lena Marsh. Marsh looked like she hadn't slept, which was probably accurate. She was still in the clothes she'd been wearing when she'd delivered the suspension notice, which meant she'd been in the building for most of the night, and she had the expression of someone who had spent those hours being told things that were rearranging the furniture of her professional understanding. I need to tell you something, Marsh said. Okay. When I delivered that notice to you, the suspension. She stopped, started again. I had questions. I had them from the beginning. The way the complaint moved through administration, the speed of it, the fact that the review board was already staffed before the incident report was even formally filed. She looked at Emily directly. I should have said something. Emily looked at her. Marsh was not a courageous manager. She was an adequate one who operated within the boundaries of institutional comfort, and she clearly knew it, and the knowing of it was visible on her face at 2:40 a.m. in a hospital corridor. Why didn't you? Emily asked. Not accusatory, actually asking. Marsh pressed her lips together. Because Marcus Reed has been in this hospital for 20 years, and I've been in this department for 8, and that math... She stopped. That math isn't an excuse, I know that. Emily looked at her for a moment. Tell Kowalski's team, she said. Whatever you noticed. The timeline irregularities you just described. Tell them in detail. Marsh nodded. And Marsh. Emily waited until the woman looked at her again. Walter Price, the patient from the OR. Make sure someone is checking in on him during recovery. He was scared before that procedure. Marsh blinked, slightly, at the redirection, the shift from federal investigation to a patient's emotional recovery. Then she nodded again, more firmly, like she was grateful for something specific to do. Emily walked toward the elevator. She made it to the lobby before her phone rang again. Different number this time. Local, hospital exchange. She answered. The voice was Farrow, Hearn's resident. He sounded controlled and specific in the way that people sounded when something had changed and they were compressing the information before they delivered it. Ms. Carter, Voss's monitors, the hepatic contusion indicators, they shifted in the last 20 minutes. Dr. Tran is with him, but there's a secondary issue. He paused. Dr. Reed just showed up on the ICU floor. He says he has attending rights on a different patient in the unit, but he's been asking the nursing staff about Voss's chart. I thought you should know. Emily stopped walking. Don't let anyone give him access to Voss's chart, she said. Under any circumstance. Get Whitmore or Okafor up there now. I already paged... Now, Farrow? She was already moving toward the elevator bank, pressing the button for the ICU floor, her reflection in the elevator's steel door showing her own face back at her. Tired, focused, not finished. The doors opened. She stepped in. and on the floor above her, the ICU monitor at bed 4 began a sound that nobody on a post-surgical ward wanted to hear at 3 in the morning. The elevator took 11 seconds to reach the ICU floor. Emily counted them without meaning to. An old habit, the kind that came from environments where 11 seconds was the difference between arriving ahead of a problem and arriving inside one. The doors opened to controlled alarm. Not chaos. ICU staff didn't do chaos. They did fast, compressed, efficient action that looked like calm from the outside and felt like a controlled fall from the inside. 2 nurses were already at Voss's bed. Tran was there, gloved, her voice level as she called out numbers and adjustments. The monitor tone that had started the sequence was still going, a regular alarm indicating pressure deviation rather than the flatline sound that meant something categorically worse. Emily read the room in the time it took to cross from the elevator to the bedside. Voss was conscious, barely, his eyes open in the specific way of someone who understood something was happening and had decided not to burn energy on a response to it yet. His pressure was dropping, not fast but steadily, and the pattern on the monitor was consistent with what Farrow had flagged. The hepatic contusion was bleeding. Not catastrophically, not yet, but the trajectory was clear. Tran looked up when Emily stepped in. Pressure's trending down. Could be contained, could be the start of active hemorrhage. I need a repeat ultrasound and a surgery consult within the next 15 minutes. Who's the on-call surgeon? Emily asked. One of the nurses said, Dr. Watkins. She's already been paged. Emily nodded. Watkins she knew. Thorough, unflappable, had none of Reed's territorial energy. If Voss needed an intervention, Watkins was the right person for it. Where's Reed? She said. The nurse who'd answered the surgeon question pointed, without looking, toward the nursing station at the end of the ICU corridor. Reed was there. He was standing at the counter with the posture of a man who had claimed space by virtue of his professional rank and expected that claim to be honored, and he was speaking to the unit clerk in a tone Emily couldn't hear from here but could characterize from the clerk's face, which was the expression of someone being pressured into something they weren't comfortable doing. Sergeant Okafor was moving toward the nursing station from the opposite direction. Whitmore's instruction had been followed. Farrow's page had connected. But Reed was already reaching across the counter toward the terminal. Emily left Voss's bedside. She covered the corridor in 10 seconds and came around the nursing station counter from the side the clerk was on, which put her between Reed and the terminal. The clerk moved back instinctively. Emily did not. I need to review the chart, Reed said, looking at her. His voice was controlled, but underneath the control there was something that wasn't. Pressure or urgency, or the specific register of a man whose timeline was collapsing. I have attending rights in this unit. On a different patient, Emily said. You told the staff you were here for a different patient. I'm concerned about the deterioration of a patient in my colleague's care. Commander Voss is not in your colleague's care. He's in Dr. Tran's care, under military medical coordination. His chart is restricted. She kept her voice even. Not loud. She didn't need loud. And Dr. Tran is with him right now, so if you have a clinical concern, you can walk down there and share it with her directly. Reed's jaw tightened. He was looking at her the way he'd looked at her in the OR hallway. The look that was recalibrating, trying to identify what leverage applied here, and finding that the usual categories weren't resolving cleanly. Okafor arrived at the station. He didn't say anything. He just positioned himself in the space to Reed's left, with the quiet efficiency of someone who had done this particular task. Be present in a way that restructures the geometry of a situation many times before. Reed looked at Okafor, looked back at Emily. This isn't over, he said. I know, Emily said. He left. She watched him go down the corridor toward the elevator, and she watched until the elevator doors closed behind him, and then she turned back to the nursing station and told the clerk to flag the chart with an access restriction under Dr. Tran's authority and document the time of the attempted access and the name of the person who'd attempted it. The clerk, who was young and had been visibly frightened 30 seconds ago, said, yes, absolutely, and began typing before Emily had finished the sentence. Watkins arrived at the ICU within 12 minutes of being paged, which was faster than the standard response, and told Emily something about the information that had traveled with that page. She was a compact woman in her late 40s who moved through the unit with the economy of motion that came from doing this specific job for a long time, and she reviewed the ultrasound findings with Tran without preamble or introduction beyond a brief professional nod. Emily stood at the edge of the conversation. She wasn't part of the clinical team on Voss. That was Tran's role, and she respected the boundary. But nobody asked her to leave, and Watkins addressed two questions to her directly during the review, which were the questions of someone who was aware of what Emily had done in the ER earlier and was willing to use the resource in front of her. The ultrasound showed free fluid in the right upper quadrant. Not a lot, but more than the initial imaging, and the progression over 3 hours was the more concerning data point than the absolute volume. Watkins looked at the images for a long time, her face doing nothing useful for anyone trying to read her assessment from the outside. "He needs an interventional approach," she said finally. "Embolization, if the vessel is identifiable. If not, we're talking an open procedure." She looked at Voss. "How's your pain?" Voss said, "Manageable," which was either true or the answer of someone who had spent enough time in austere medical conditions that his baseline for manageable was recalibrated. "That's not actually what I asked," Watkins said. He looked at her. "It's a 7. Better." She made a note. "We're going to move fast on this. I want IR on the phone now." She was mid-sentence when Emily's phone buzzed. She stepped back, checked the screen. "Kowalski." She answered and walked 2 steps farther from the bedside. "Go ahead." "We have a problem." Kowalski's voice had the particular flatness of someone delivering information they'd verified before calling. "Reed has a lawyer. The lawyer contacted the hospital's general counsel 40 minutes ago and filed an emergency injunction request to pause the federal investigation on grounds of procedural irregularity. They're claiming the OIG exceeded jurisdictional authority in obtaining the hospital's internal documentation." Emily was quiet for a moment. "Can they get that?" "The injunction?" "No. The documentation was obtained through proper federal subpoena, but the filing creates a delay, and the delay—" Kowalski paused. "The lawyer is also claiming that the federal investigation was triggered by a witness with a compromised employment status, meaning you. They're trying to discredit my statement. They're trying to discredit your standing to give one. If they can establish that you were acting with a personal grievance rather than—" "I understand the argument," Emily said. She was looking at the ICU corridor, the fluorescent-lit stretch of it, the nurse moving past with a medication tray, the ordinary persistent activity of a hospital at 3 a.m. "What do you need from me?" "Your military record," Kowalski said. "The classified portions. We've submitted a formal request to DHA for expedited declassification of the portions relevant to your medical training and operational history. If we can establish your qualifications independent of your employment record at North Valley, the argument that you're just a disgruntled nurse with an axe to grind loses most of its weight. That's going to take time." "Colonel Whitmore is in a room right now working the declassification request in real time," Kowalski said. "He flagged it as priority when we explained the situation." Emily processed this. Whitmore in a room somewhere in this building at 3 a.m. working a declassification request on her behalf. Voss in a bed 30 feet away needing a procedure. Reed somewhere in this building or recently left it, with a lawyer who had filed an injunction within hours of the federal team arriving. The speed of that was worth noting. The lawyer had been ready. The injunction language had been prepared. Reed had not called a lawyer after Kowalski's team arrived. He had called one who was already briefed on the situation, which meant he'd known the investigation was coming before it walked through the door. "Kowalski," she said, "how long has Reed known about the OIG audit?" A brief pause. "Why?" The injunction was prepared. The lawyer was ready. He didn't make calls tonight. He made calls that had already been made. She watched Farrow emerge from Voss's room and move toward the nursing station. Someone told him the audit was moving. Someone with access to the investigation timeline. The silence on Kowalski's end was a specific kind of silence, the kind where someone was writing something down. "We'll look at that," Kowalski said. "Don't discuss it with anyone except Whitmore." "Understood." She ended the call, stood in the corridor. Farrow reached the nursing station and began pulling up something on the terminal, his movements efficient and focused. Behind him, through the window of Voss's room, she could see Watkins speaking to Tran, the two of them aligned over the imaging, the particular posture of two clinicians who have agreed on a course of action and are organizing around it. She went to find Whitmore. What? He was in the smaller of the two family waiting rooms on the ICU floor, the one Emily hadn't been in before. Different corridor, slightly larger, with a window that showed the dark parking structure, and beyond it, the first theoretical gray of early morning trying and failing to be visible against the still black sky. He had his phone to his ear when she came in. He held up one finger, finished the call in 2 sentences, and set the phone face down on the table. "Kowalski called you," he said. "The injunction and the record request, yes." She sat across from him. The chair was harder than the one in the other waiting room. "I think Reed had advance notice of the audit." Whitmore nodded slowly. "That thought occurred to us about 20 minutes ago. We're looking at the possibility of a disclosure from within the OIG's contractor network. The audit used an outside billing analysis firm for the preliminary review, and that firm's access logs are being examined. If you knew it was coming, then the complaint against you wasn't just damage control. It was evidentiary cleanup." Whitmore said this with the tired precision of someone stating a conclusion they'd already reached. A suspended nurse with a pending termination is a significantly less credible witness than a nurse in good standing. Emily looked at the dark window. A car moved through the parking structure below, its headlights sweeping the concrete in a brief yellow arc and then disappearing. "The declassification," she said. "How long?" "By morning," Whitmore said. "The relevant sections are limited. Your training credentials, your operational deployments, your commendation record. None of the classified operational details, just enough to establish who you actually are." She thought about that phrase. Who you actually are. She'd spent 3 years at North Valley being one version of that. The version that wore scrubs and carried a tablet and checked on frightened patients and got talked past in surgical briefings. The version that had seemed, in the context of that building and that career, like the complete picture. "Are you going to be all right with that being out?" Whitmore asked. He was looking at her directly, not as a general looking at an asset, as someone who had known her in a different context and understood that context mattered. "Not really," she said, "but it's not the most important thing happening tonight." He accepted this. "Voss? Watkins is taking him to IR for embolization. If the vessel is accessible, it's manageable. If not..." She left the conditional where it was. "She's good," Whitmore said. "Yes." He was quiet for a moment. Outside, the parking structure was dark again. The window reflected the waiting room back at them. 2 people in institutional chairs, the table, the dead coffee machine. "Reed is still in the building," Whitmore said. "Security logs show him on the surgical floor. His lawyer is in the lobby." Emily sat up slightly. "He doesn't have any surgical cases tonight." "No." "Then what is he..." Her phone buzzed. Text, not call. She looked at the screen. It was from an internal hospital number she didn't immediately recognize, and the message was 3 words. "Check the server." She stared at it. "Whitmore." She turned the phone so he could see it. He looked at the message. Then he picked up his own phone and made a call that connected in under 4 seconds, which meant the person on the other end was already awake and already waiting. "Delgado, get someone to the hospital's medical records server room. Now." He was already standing. "And get Kowalski." Emily was already moving toward the door. The server room was in the basement of the building. She knew the layout from 3 years of working there, the geography of the building embedded in her, the way the geography of every building she'd spent significant time in was embedded in her. Stairs were faster than the elevator. She took the stairs. She was 2 floors down and moving through the basement corridor when she heard it, a sound that was wrong for 3:40 in the morning in a hospital basement, which was a place that was never fully silent but maintained a specific acoustic signature of machinery and ventilation and nothing else. Footsteps, moving fast. Away from her, deeper into the corridor. She went after them. The basement corridor branched into 2 directions near the central plant, left toward the loading dock and the utility systems, right toward the records room and server infrastructure. The footsteps had gone right. She followed, rounding the corner, and came into the records section corridor in time to see a door. The server room door, heavy, gray, marked with the hospital's IT asset designation, swinging closed. She covered the remaining distance and pushed through the door. The server room was cool and loud in the specific way server rooms were loud. The sustained white noise of cooling systems and processing equipment, racks of hardware running in the blue-white light of status indicators. And at the far end, crouched at a terminal that had been patched into the rack with a device she recognized as a direct-write USB overwrite unit, a method for physically corrupting stored data that left no software trace, was a person in hospital clothing who was not Marcus Reed. It was Philip Garrett, the hospital's chief information officer, who had been at North Valley for 6 years and who Emily had spoken to exactly 4 times in her nursing career and remembered as efficient and unremarkable. He looked up when she came through the door. He had the expression of someone whose particular category of calculation had just changed without warning, and for a moment neither of them moved, and the server room noise filled the space between them with its indifferent machine hum. Then he reached for the device. Emily crossed the room in 4 steps, caught his wrist before his hand reached the hardware, and applied a hold that had nothing to do with her nursing training and everything to do with the 8 years before it. He made a sound, surprise and pain together, and his other hand came up, and she redirected it with the same economy she applied to everything else. And then she had him against the rack with his wrist immobilized and the USB device on the floor between them, still attached to its cable, not yet triggered. "Don't," she said, simply, without emphasis. Garrett stopped moving. He was breathing hard. He was not a physically dangerous person. She had assessed that in the first 2 seconds. But he was frightened in the way of someone who understood exactly how much trouble had just arrived. Behind her, the server room door opened. She heard Okafor's voice. "Carter?" "We're fine," she said without turning around. "Get Kowalski. And someone needs to secure that device before anyone touches it. It's evidence." She kept her hold on Garrett's wrist. He wasn't going anywhere. On the floor between them, the USB overwrite unit blinked its single red status light at regular intervals, passive and patient, recording nothing. Having destroyed nothing, stopped with seconds to spare from doing both. From somewhere above them, through the building's infrastructure, came the distant sound of the interventional radiology suite going active, Watkins, beginning the procedure that would keep Voss alive. And Garrett, pinned to the server rack in the blue-white light, said the thing Emily had been waiting since Monday for someone to finally say out loud. "Reed told me the investigation was almost done," he said. His voice was ragged. He said if the records were gone, there was nothing to prosecute. The server room hummed. Emily looked at him. "Who told Reed?" she said. Garrett opened his mouth, closed it, looked at the floor. "Philip." She kept her voice level, kept the hold exactly where it was. "Who told Reed the investigation was coming?" He looked up at her. His face, in the blue equipment light, had the look of someone standing at the edge of a decision that was going to define everything after it. He said a name, and the name was not one Emily had expected. The name Garrett said was Dr. Sandra Holt. Emily knew the name. Everyone at North Valley knew the name. Holt was the chief medical officer, the person who sat between the medical staff and the board, the person whose signature appeared on policy documents and credentialing decisions, and Emily now understood, on the administrative suspension notice she'd received 5 days ago. Holt had been at North Valley for 11 years. She'd been on the panel that hired Reed. She'd co-signed the review board that was processing Emily's complaint. She'd also, according to Garrett's accounting of the last 8 months, been feeding Reed information about the OIG audit since it began. Emily stood in the server room and absorbed this without moving. Okafor behind her was already on his radio. She released Garrett's wrist. He stayed where he was against the rack, not because she was holding him there anymore, but because the specific quality of what he'd just done had settled on him and taken the initiative out of his legs. He looked at the floor. He was breathing in the shallow, quick pattern of someone who had crossed a line they couldn't uncross and were beginning to understand the shape of what came next. "Did Holt know about the server room?" Emily asked. "She told me to—" He stopped. Started again. "She said the records needed to be cleaned. She said it was to protect the hospital." Did she know you were here tonight specifically? He nodded. A small, definitive movement. Emily looked at Okafor. He was already on it. She could hear the relay of information moving through his radio to wherever Kowalski and Whitmore were. She stepped back from Garrett, picked up the USB device carefully by the cable end, and set it on top of the server rack out of reach. It was evidence. It hadn't done anything yet. That mattered. Stay here, she told Garrett. She wasn't sure he had the capacity to do otherwise. Kowalski arrived in the server room 4 minutes later with 2 members of her team and the expression of someone who had been handed an entirely new problem at 4 in the morning and was already calibrating it into the existing structure of the case. She looked at Garrett. She looked at the device on the rack. She looked at Emily. He said, "Holt," Emily said. Kowalski closed her eyes for approximately 1 second, opened them. All right. She turned to her team and gave instructions in a sequence that was tight and operational, no wasted words. And the 2 agents moved with the specific efficiency of people who understood exactly what they were doing and why the timeline mattered. Emily stepped out of the server room and into the corridor. Whitmore was there. He looked at her. She gave him the summary in 4 sentences. Garrett, Holt, the advanced disclosure, the attempted deletion. He listened without interrupting, and when she finished, he said, "Where's Reed now?" to Okafor, who checked his radio and said, "Still on the surgical floor." Whitmore said, "We need to move on Holt before she knows Garrett didn't finish." "She's not in the building," Emily said. "The CMO doesn't keep hospital hours past 11 unless there's a specific board event." She paused. "But she's in contact with Reed. If she's monitoring his status and she loses communication, she'll run," Whitmore finished. "Or she'll call someone who doesn't work at this hospital." He processed this for exactly the time it took to be useful. "I'll get Kowalski's federal contacts on Holt's location. Her home address is in the hospital credentialing records. Kowalski's team will need it through proper channels, or the lawyer eats it. Kowalski knows that." He was already on his phone. Emily leaned against the corridor wall. The basement was the same as it had been 20 minutes ago. Ventilation hum, fluorescent light, the sound of machinery doing its patient, constant work. She was tired in a way that had weight to it. The specific accumulation of 18 hours of sustained high-stakes function without rest. She knew the feeling. She'd worked through worse. It didn't make it comfortable. Her phone buzzed. Text from an ICU number. Embolization successful. Patient stable. Watkins. She let out a breath she'd been holding since the elevator. By 5:30 in the morning, the following things were true. Philip Garrett was in federal custody, having waived his right to wait for personal counsel after Kowalski's team laid out the evidence against him in terms that made waiting seem like a poor allocation of available goodwill. He gave a formal statement that corroborated everything Emily had inferred and added several details she hadn't. Specifically, the mechanism by which Holt had been receiving OIG information, which involved a former contractor at the billing analysis firm who had a financial relationship with a property LLC that Holt co-owned through a third party. The financial thread was the kind that federal investigators followed with focused appetite. Dr. Sandra Holt was located at her home 16 miles from the hospital and was asked, through the formal legal mechanism of a federal knock and talk, to come in for a conversation. She declined. She then called her lawyer. The lawyer arrived, and the conversation became a different kind of conversation, one that would continue for several more days in settings with better furniture and worse outcomes for his client. Reed's lawyer, having filed the emergency injunction on the basis that the investigation had been triggered by a compromised witness, received a communication from Kowalski's office at approximately 6 in the morning informing him that the investigation's evidentiary basis had expanded significantly overnight and now included multiple additional witnesses and physical evidence unrelated to his client's employment complaint. The injunction request was withdrawn before the courthouse opened. Emily learned all of this sequentially between 6 and 7 in the morning, while sitting in the hospital cafeteria drinking coffee that was fresh because the kitchen staff arrived at 5:30 and ran the machines before the breakfast service. She ate half a piece of toast. She wasn't particularly hungry, but she understood the mechanics of sustained function well enough to eat something anyway. Farrow found her there at 7:10. He looked like he'd been awake all night, which he had, and he had the particular brightness of someone running on the second wind of an interesting shift. "Voss is asking for you," he said. "I'll go up in a few minutes." He sat down across from her without being invited, which she didn't mind. "Can I ask you something?" "Probably." "The technique you used in the ER, the thoracic diagnosis, the specific sequence you ran through to identify the hemothorax before the imaging confirmed it." He was leaning forward slightly. "I've been looking at the presentation pattern, and I can't find a standard emergency medicine protocol that matches the order you used." Emily looked at him. He was a second-year resident, bright, methodical, the kind of person who went home from an interesting case and read about it instead of sleeping. She recognized the type because she had been the type, in a different context. "It's a modified triage protocol from a high-volume trauma environment," she said. "Not standard civilian EM. The sequencing prioritizes thoracic over abdominal in blast or blunt force cases because of how overpressure injuries tend to present in the first hour." Farrow was quiet for a moment, processing this. "Where does someone learn that?" "Places that aren't this hospital," she said. He accepted this with the grace of someone who recognized a boundary and respected it. He stood. "For what it's worth," he said, "I'm going to be telling the story of last night for the rest of my residency." She almost smiled. "Get some sleep, Farrow." He went. Voss was sitting up when she reached the ICU. Not fully, the adjustable bed angled at about 30 degrees, which was progress from flat. He had color that he hadn't had at 3 in the morning, which was the most immediately legible improvement. He still looked like someone who had been in the near vicinity of an explosion and then had emergency vascular surgery, which was because that was what had happened to him, and no amount of medical success changed the fundamental accounting of blunt physical damage. He looked at her when she came in and said, "You have that look." "What look?" "The one where you've been managing something complicated for a long time and you're deciding how much of it to say out loud." She sat in the chair beside the bed. "The investigation is in good shape. Kowalski's team has what they need. Reed and Holt are both—" She paused. "It's moving." "Holt." He said the name carefully. "The CMO." She was the source of the audit disclosure. He processed this. "That's going to be a significant case." "Yes." "Are you in it?" "I'm a cooperating witness. My statement is part of the record." She looked at the window. The morning was actually visible now, gray but present, the early light coming in at the low angle of a November morning. "Whitmore submitted the declassification request last night. My training record and deployment history. Kowalski needed it to counter the argument that I was a disgruntled employee." Voss was quiet for a moment. "How do you feel about that?" She considered the question. It was a real question and deserved a real answer. "I feel like I wanted to be a nurse in a hospital," she said, "not a case study." "You can still be a nurse in a hospital." "Not this one. Not after—" She stopped. "It's complicated now." "Maybe." He shifted slightly against the bed, the movement careful. "Or maybe it's less complicated than it was a week ago." She looked at him. He was watching her with the specific attention of someone who meant what he was saying and was choosing to mean it in the open. "You always did that," she said. "What?" "Made the direct version sound obvious, like the complicated reading was the error." "Sometimes it is," he said. She didn't argue. At 9 in the morning, the hospital held an emergency board meeting. Emily wasn't in it, but Whitmore was, and Kowalski's lead counsel was, and the hospital's general counsel was. And by the time it concluded 45 minutes later, Dr. Marcus Reed had been formally relieved of clinical duties pending the outcome of the federal investigation, his access credentials had been deactivated, and a notice had been placed in his credentialing file that would follow any application he made to another institution. The board had also, according to Whitmore's account of the meeting, voted to cooperate fully with the federal investigation and to retain an independent compliance firm to audit the last 4 years of Reed's clinical record. This last item was not generosity. It was the board understanding that full cooperation was the only available path that didn't end with the institution itself in front of a federal judge. Emily heard about the board meeting from Whitmore in the hallway outside the ICU. He delivered the information concisely and without editorial, which was his manner. She listened without interrupting. When he finished, she said, "Walter Price?" Whitmore looked at her. "The patient from the OR. The original incident. I want to make sure his care isn't—" She stopped, recalibrated. "He's in recovery. With Reed off clinical duties, someone needs to be actively managing his post-op." Whitmore said, "I'll flag it with the board's compliance coordinator." "Good." He looked at her for a moment. "You're aware that what happens next, the investigation, the testimony, the public record, is going to make your prior service part of the public record too." "I know. The work you did, the operational history. People are going to ask about it." "People can ask," she said. "I'll answer what I can answer." He nodded. "You could come back," he said, and it was the most direct he'd been about anything personal in the 18 hours since he'd arrived. "Not field work. The Defense Health Agency has training and curriculum roles, the kind that uses what you know without putting you back in an operating environment." She looked at the ICU door. Through the window, she could see the nurse doing Voss's morning assessment, the routine care of someone being kept alive and monitored and given the conditions to recover. "Let me finish this first," she said. "That's not a no." "It's not a no," she confirmed. Reed left the building at 10:47 in the morning. Emily wasn't watching for it. She was in the administrative wing reviewing her statement documentation with one of Kowalski's agents when Marsh appeared in the doorway and said quietly, "He just went through the main lobby." Emily didn't go to watch. She didn't need the visual. She had been in enough situations where the moment of departure was less important than everything that had caused it. What she did do, when the documentation review was finished, was walk to the recovery unit on the second floor and find Walter Price. He was in bed 14, awake, eating breakfast with the careful attention of someone who had been told to take it slowly. He looked up when she came in, and the recognition on his face was immediate. "The nurse," he said, "from the morning of." "Morning of," she confirmed. She came to the chair beside the bed. "How are you feeling?" "Like someone opened my neck up." He paused. "Which they did." He studied her for a moment. "Something happened. I could tell from how the staff was moving last night, the kind of moving that's about something other than regular medicine." "There was a situation in the hospital," she said. "It's being handled." "The surgeon? Reed?" She looked at him. He was 63 and not inclined to be managed by vague language. "There's an investigation," she said. "He's been relieved of duty." Price absorbed this. He picked up his fork and moved a piece of scrambled egg around the plate, and then put the fork down without eating it. "The morning of my procedure," he said, "I asked you if you were any good." "I remember." "You said good enough." He looked at her steadily. "You were being modest." "I was being accurate," she said. He almost laughed. The almost was all the restriction of a man who had been told not to make sudden movements with his neck for the next week. "Is your job okay?" "I heard, before the procedure, the nursing aide said something about a complaint." "It's complicated," Emily said, "but it's moving in the right direction." He seemed to accept this. He picked up his fork again and this time ate the egg. "My wife is coming in at noon," he said. "She was in Atlanta when I went in for the surgery. Couldn't get a flight back until this morning." He looked at the window. "She's going to want to know everything that happened." "Tell her what you know," Emily said. "That's enough." She stayed another 10 minutes. Not clinically, just as a person in a chair beside a patient who had been through something significant and whose wife was still an hour away. When she left, he said thank you in the direct, spare way of a man who didn't inflate his language, and she nodded and went. The thing about institutional collapse, Emily had come to understand, was that it didn't happen the way it looked from the outside. From the outside, it appeared sudden. A board meeting, a revoked credential, a federal investigation, a news cycle. From the inside, it was the accumulation of 1,000 small failures of integrity over years, each one individually survivable, each one making the next one marginally easier to commit, until the structure was so compromised that the weight of a single investigation could bring it down. Reed had not become what he was overnight. She'd understood that intellectually for 3 years and understood it differently now. She was in the stairwell between the second and third floors at 11 in the morning. She'd taken the stairs because the elevator on that wing was slow, and because the stairwell was one of the few places in the building that was genuinely quiet, when she heard the door open above her and footsteps coming down. She recognized the footsteps before she saw the person, or she thought she did, and then she looked up and it was Holt. Sandra Holt was 54, silver-haired, with the groomed composure of a person who had spent decades managing optics. She was in her work clothes, which meant she'd come in after the early morning knock and talk, probably at her lawyer's instruction, appearing voluntarily to prevent a more public intervention. She had her badge on. She was walking downstairs in her own hospital. She stopped when she saw Emily. A half-second stop, the kind that was involuntary. Emily stood on the landing below her and said nothing. Holt came down 2 more steps. She had, whatever else she was, a specific kind of nerve. The nerve of someone who had been managing difficult situations through the force of professional authority for a long time and had not yet fully recalibrated to a world where that authority had limits. "Miss Carter," she said, as though this were a corridor encounter of no particular significance. "Dr. Holt?" Holt looked at her for a moment. Something moved across her face. Assessment, Emily thought. The assessment of someone determining what Emily knew and how much of it could still be managed. Then she said, "This situation has become complicated in ways that I don't think serve anyone well. Least of all, the hospital." "The hospital," Emily said. "The patients, the staff." Holt's voice was composed, careful. "There are ways to move through investigations that minimize damage to institutional function, that protect the people who depend on this place." Emily looked at her. The stairwell smelled like concrete and cleaning solution. Somewhere above them, a door opened and closed. "You told Reed the audit was coming," Emily said, "and when Garrett tried to destroy the evidence at your instruction, your plan was to let the investigation conclude with a data gap that buried 4 years of Reed's record." She kept her voice even. "That's not protecting the hospital. That's protecting yourself." Holt's jaw tightened. "You don't understand the pressures of Dr. Holt." Emily took 1 step up, not aggressive, just closing the conversational distance. "I've been a witness in a federal investigation since 2 in the morning. Everything Garrett told Kowalski's team is on record. Everything I've observed and documented is on record. Your conversation with me right now is—" She paused. "You should stop talking and call your lawyer." Holt looked at her. For the first time since they'd been on the landing together, the composure showed its infrastructure, the effort it was taking to maintain, the specific muscle of a person holding something up that was getting heavy. She went past Emily without another word and continued down the stairs. Emily listened to her footsteps go. They didn't slow. They didn't stop. She heard the ground floor door open and close. She took out her phone and sent a text to Kowalski. "Holt is in the building, stairwell B, heading to ground floor. Spoke to me." The response came back in 40 seconds. "We have her. Stand by." Emily went back up the stairs. At 2 in the afternoon, Whitmore found her in the ICU family waiting room. The first one, the one with the broken coffee machine. She'd sat there long enough that she'd stopped seeing the room. "Kowalski has Holt informal interview," he said. "She has counsel present, but she's talking. The financial connection to the billing firm contractor is confirmed through 3 independent records. Reed's lawyer contacted Kowalski's office an hour ago about a cooperation arrangement." Emily looked up. "Reed's cooperating?" "His lawyer is exploring what cooperation would look like," Whitmore said. There was something in the careful distinction that told her what it meant. The lawyer understood that the case was complete enough that Reed's testimony was not essential, which meant the leverage he was hoping for didn't exist, and the conversation was going to be short. "There are 6 cases," Whitmore continued. He sat. He had, over the course of the night and into the day, moved from the posture of a superior officer managing an asset to something closer to the posture of a person who had spent a long time keeping track of someone from a distance and was relieved to be in the same room. 6 prior patient cases where Reed's clinical decisions resulted in harm that was internally documented and then suppressed. 3 of those patients are still alive. The compliance review the board ordered this morning will formally identify all 6. Emily was quiet. "The families of the 3 who are not still alive," Whitmore said, "they're going to need to be notified." "I know. That's not going to be... I know." She said it again, not to cut him off, just because there wasn't additional language for what that meant. Those families had buried someone believing a particular story, and the correct story was worse. And nothing about the investigation or the justice it produced would make that exchange feel like anything other than what it was. Kowalski's team will handle the notifications, Whitmore said. You won't be directly involved. I know, she said for the third time. And this time the word had a different texture, not shutting down the conversation, but arriving at the floor of it. They sat in the waiting room for a moment without speaking. The broken coffee machine was exactly as broken as it had been the night before. The declassification came through, Whitmore said, 40 minutes ago. Your training credentials, deployment record, and commendation history are now available to Kowalski's team. The argument that you were a compromised witness with no standing is, he paused. Gone. She nodded. There's one more thing. He shifted in his chair. This was, she could tell, the thing he'd been building toward since he sat down. The commendation, the one from the Delvara operation. It was classified at the time for operational reasons. He looked at her steadily. General Krauss has recommended it be formally presented. Not quietly, not internally, publicly. Emily looked at him. It was earned publicly, Whitmore said, even if no one knew it at the time. She looked at the window. The afternoon light was stronger than the morning had been, the gray having thinned out to something with actual illumination in it. When? She said. The general wants to schedule it before Voss is discharged. A pause. He thought Voss would want to be present. She sat with that. There's also the board, Whitmore said. North Valley's board is going to need to formally address your employment status. The suspension notice, the pending termination review, all of it is going to need to be officially resolved. Kowalski needs me here through the investigation anyway. Yes, but beyond that, he stopped, started again. Emily. He used her first name, which was rare enough that she noticed it. You spent 3 years in this building being told you were less than you are, and you let them, because you'd made a choice about how much of your past to carry into this place. She looked at him. You don't have to let them anymore, he said. The waiting room was quiet. The building moved around them, footsteps, a distant PA announcement, the ordinary continuous sound of a hospital doing what hospitals did. One thing at a time, she said. That's fair. Her phone buzzed. She looked at the screen. It was Kowalski. Not a text. A call. She answered. Kowalski said, I need you back in the conference room, now. Her voice had a quality Emily hadn't heard from her before. See, not alarm exactly, but the compressed alertness of someone who has just been handed information they hadn't anticipated. What happened? The billing contractor, Kowalski said. The one with the financial connection to Holtz LLC. He's been talking to our forensic accounting team for the last hour. A brief pause. Carter, the financial network is bigger than North Valley. Reed was billing federal healthcare programs under patient codes that didn't match the procedures performed. The discrepancy goes back 7 years, and the amount, she paused again. The amount is significant enough that this stops being a medical misconduct case. Emily stood. What does it become? She said. Federal healthcare fraud, Kowalski said. And Reed's name isn't the only one on the billing authorizations. Emily looked at Whitmore, who was reading her face. There are co-signatories, Kowalski said. On the fraudulent billing records, Dr. Holt is one. The other two are not hospital employees. Emily was already moving toward the door. Who are they? Kowalski said the names, and Emily stopped walking, because one of them was the name of the man who had appointed Holt to the CMO position 11 years ago, who sat on the North Valley board as a founding trustee, who had been at the hospital's anniversary gala 18 days ago, shaking hands and accepting a crystal plaque for 30 years of community commitment. And the other name was someone she knew from before North Valley, from a different life, from a context that had nothing to do with Crestwood or a hospital or a suspended nurse badge, a name from the operational world, a name that should not exist anywhere near a civilian hospital's billing records. Carter, Kowalski said, are you still there? She was standing in the doorway of the waiting room, one hand on the frame, the afternoon light coming in at the end of the corridor. I'm here, she said. Do you recognize those names? She looked at the light, at the corridor, at the ordinary persistent activity of the building around her. One of them, she said carefully, I need to tell Colonel Whitmore about before I tell you anything else. The silence on Kowalski's end was the silence of a federal agent understanding that the case she'd been building for 8 months had just grown a dimension she hadn't measured. How fast can you get to the conference room? Kowalski asked. Emily was already walking. She told Whitmore in the corridor before they reached the conference room, because some information had a half-life of seconds before it became dangerous to carry alone. The name from the operational world was Adrian Merck. She'd known him not as a hospital trustee or a healthcare administrator, but as a logistics contractor who had operated in the same theater she had during her second deployment. A man who had moved equipment and medical supplies through difficult terrain and who had, on 2 occasions she was aware of, and possibly more she wasn't, moved other things through the same channels with less documentation. She had reported it once, informally, to her commanding officer at the time. She didn't know what had happened with that report. She had not thought about Adrian Merck in 3 years. She told Whitmore this in approximately 90 seconds, standing in the corridor outside the conference room. He listened without interrupting. When she finished, his face had the quality of someone who had just watched 2 separate problems resolve into one larger problem that was both worse and more manageable than either had been individually. Merck has been on the North Valley board for 8 years, Whitmore said. He didn't have that role when I knew him. No. Whitmore looked at the conference room door. But the billing fraud going back 7 years, that timeline starts 1 year after he joined the board. She let that sit for a moment. The informal report I filed, she said, from the deployment. We'll find it, Whitmore said. Whatever happened with it, we'll find it. He looked at her. Go in. Tell Kowalski what you told me. I'm going to make a call. He stepped back down the corridor. She went into the conference room. What followed was not a single dramatic revelation, but the slower, grinding work of institutional accountability, which was, Emily had come to understand over the last 24 hours, both more satisfying and more exhausting than the dramatic version looked from the outside. Kowalski received the information about Merck with the focused attention of someone who had been handed a key to a door they hadn't known existed until 30 seconds ago. She asked precise follow-up questions. She took detailed notes. She excused herself twice to make calls, and when she came back the second time, she had the specific expression of a federal investigator whose case had just grown large enough to require additional personnel. Merck's name on the billing authorizations goes back to the first year of the fraud, Kowalski said when she'd assembled enough to speak. He co-signed as a board-level compliance approver, which is a role that shouldn't have had access to individual billing records. But the hospital's governance structure gave the board's finance committee oversight authority that was broad enough to obscure it. She paused. He was the authorization layer that made the fraud look internally reviewed. And Holt ran the operational side, Emily said. Holt and Reed ran the clinical side. The billing manipulation required someone with board-level access to prevent it from triggering the hospital's own compliance flags. Kowalski looked at her documentation. 7 years, the total amount flagged so far it's a significant federal healthcare fraud case. We're going to need to bring in the FBI's Financial Crimes Division for the full accounting. Emily thought about the billing records. About 7 years of manipulated codes and falsified procedure documentation, and the patients behind every line item. Patients who had been billed for procedures that weren't performed, or had procedures performed that weren't clinically indicated, or had been used as billing vehicles for a financial network that existed entirely outside their knowledge or consent. The patients in those records, she said, will be identified and notified, Kowalski said. Every one of them. Emily nodded. There's something else, Kowalski said. She said it with the particular care of someone who is about to deliver information that has personal relevance rather than just case relevance. The informal report you filed during deployment about Merck's logistics irregularities. Whitmore's team found it in the DHA records archive 40 minutes ago. Emily went still. It was received, logged, and then reclassified, Kowalski said, not formally buried. Reclassified under a review category that effectively paused any action on it indefinitely. She looked at Emily steadily. There's a name on the reclassification order. It's not anyone in this room, but it's someone whose connection to Merck is now part of what we're looking at. The conference room was quiet. Kowalski's agent near the door was very carefully looking at his notes. Emily said, "How far does this go?" "Far enough that the answer to that question takes longer than today," Kowalski said. "What I can tell you is that your report didn't disappear because it was wrong. It disappeared because the right people didn't want it to go anywhere." Emily sat with that. With 3 years of it, in a way, 3 years of having filed something that she'd never received a response to, that she'd eventually concluded had simply not been significant enough or sufficiently evidenced to generate action. The quiet, accumulated weight of having done the right thing and watching it sink without a trace. It hadn't sunk because it was wrong. It had sunk because someone had made sure it would. There was something about that which was both clarifying and very, very difficult to sit next to. "What do you need from me?" she said. "Your formal account of your interaction with Merck during deployment, documented, signed, submitted to our record." Kowalski paused. "And your trust that the people in this case now are going to take it somewhere your report didn't get to go before." Emily looked at her. Kowalski was direct, competent, and running on as little sleep as anyone else in the building. She had done things correctly in this investigation. The right subpoenas, the right protocol, no shortcuts that would give Reed's lawyer purchase. She had protected the process. "All right," Emily said. She said it the same way she'd said it the night before, in the same room, to a different question, without ceremony, because the decision was the same. The work matters. Do the work. Adrian Merck was taken into federal custody at 4:17 in the afternoon. He was at his office 12 miles from Crestwood when 2 FBI agents and a member of Kowalski's team arrived with a warrant. His lawyer was present within the hour, but the warrant covered financial records that had already been seized, and the cooperation window, the narrow period where a degree of candor might have modified the outcome, closed fast. The fourth name on the billing records, the founding board trustee whose plaque hung in the lobby, was a man named Gerald Faust. He was 71, and when FBI agents arrived at his home that afternoon, he was, according to the brief account Whitmore relayed to Emily later, surprised in the way of someone who has spent years believing that their position in a community rendered them structurally invisible to this particular category of consequence. He was wrong about that. He had been wrong about it for 7 years. Reed's lawyer called Kowalski's office again at 5 in the afternoon. The conversation lasted longer than the previous one. By 6, Reed had agreed to provide a full cooperation statement in exchange for a sentencing recommendation, which was what happened when the case was airtight enough that the only available currency was information and the only available transaction was getting ahead of the evidence. He gave them Holt. He gave them Faust. He gave them the specific mechanism of the billing manipulation and the chain of approvals that had kept it running for 7 years. He also gave them, without being asked, the names of 3 additional staff members who had raised clinical concerns about his practices over 4 years and been systematically pressured into silence. 2 of them were still employed at North Valley. 1 had left the state. Kowalski's team contacted all 3 that evening. Emily learned about this in pieces, across the afternoon, between her own documentation sessions and 2 return trips to the ICU to check on Voss. She was not at the center of those operations. She was a witness, a cooperator, a person with specific and essential knowledge who had provided that knowledge and was now watching the institutional machinery do what it was built to do when someone finally gave it the right inputs. There was something humbling about that, something that she hadn't expected. She had spent 3 years keeping her head down, doing the work, not asking for the system to function correctly because she'd calibrated her expectations to the system she could see. The system she could see had been Reed and Holt and a complaint process that moved at the speed of whoever had an interest in slowing it. She had managed within that system because she had not believed quite that a different one was available. Voss had been right. She hadn't been completely alone. She'd just stopped looking for the door. On the second morning after the server room, which was, by Emily's count, the 7th day since she'd been handed a suspension notice and walked out of North Valley into a gray afternoon, the hospital's board of trustees held a second emergency meeting. This one she was invited to attend. She sat in the boardroom on the 4th floor, which she had never been in before, and looked at the mahogany table and the chairs and the portraits on the wall and the general architecture of institutional authority that she'd been below the line of for her entire time at North Valley. The remaining board members, Faust was gone, his seat empty and his plaque presumably a question for whoever handled that kind of institutional housekeeping, sat across from her with the expressions of people who understood that the meeting they were in was fundamentally about error correction and that the error had been theirs. The board chair was a woman named Patricia Soule, 68, who had not been part of the fraud and who had spent the previous 24 hours being briefed on the extent of what had happened inside the institution she was responsible for governing. She had, by all available evidence, taken the briefing the way someone took a physical blow, absorbing it, staying upright, deciding what to do next. Soule spoke first. She addressed Emily directly, which Emily had not been certain she would. The board has reviewed the complete record of your suspension and the circumstances that led to it, Soule said. We have also reviewed the preliminary findings of the federal investigation and the internal compliance review that is now underway. She paused. What was done to you by this institution, the suppression of your clinical intervention, the weaponization of the complaint process, the speed and nature of the suspension, was wrong. The board acknowledges that without qualification. Emily listened. The suspension is rescinded, effective immediately, Soule continued. Your employment record will be corrected to reflect that the complaint filed against you was without clinical merit and was part of a pattern of institutional misconduct. The HR file will be amended and the review notice will be removed. She stopped. That is the minimum of what you're owed, and we know it. Emily looked at the table. She looked at the board members. She thought about the morning she'd walked out of this building and stood on the sidewalk and answered a phone call from a 703 area code. She thought about Dorothea Baines and her applesauce and the question about being treated unfairly. She thought about Pharaoh staying awake all night because the medicine was interesting. She thought about Marsh standing in the corridor at 2:40 in the morning, saying the words she should have said 5 days earlier. There's also the question of your role going forward, Soule said, if you choose to remain at North Valley. I'm listening, Emily said. The investigation has identified significant deficiencies in our trauma response protocols, our internal complaint systems, and our clinical oversight structure. All of those need to be rebuilt. Soule met her eyes. The board would like to offer you a senior role in the design and implementation of the new clinical training and safety framework. Not a nursing role. A leadership role. One with actual authority over the systems that failed. Emily looked at her. That's a significant change from nursing. Yes, Soule said. We're aware. I'd need time to consider it. Of course. She needed to think about Whitmore's offer alongside Soule's. She needed to think about what she actually wanted, which was a question she hadn't allowed herself to ask clearly for 3 years, because the answer had felt like it required a context she no longer had. The context had changed. The question remained. I'll give you an answer within the week, she said. Soule nodded. The board members on either side of her nodded too, a small wave of institutional acquiescence that was the body language of people who understood they were not in the position to negotiate. Emily left the boardroom. The formal military ceremony was held 4 days later in the hospital's main conference center on the ground floor. It was not large. Whitmore had been specific about that, and Emily had been grateful. But it was not private either, because some things needed to happen in front of witnesses to have their full meaning. Voss was there. He'd been discharged from the ICU to a step-down room 2 days earlier and had been ambulatory since the morning of the ceremony, moving carefully, with the particular economy of someone managing real physical limitation without making it the center of every interaction. He sat in the front row in a chair that Okafor had positioned specifically to give him a clear line of sight without requiring him to stand. Marsh was there. Hearn was there. Pharaoh was there, looking like he'd slept for approximately 16 hours and recovered the use of his face. The unit clerk from the ICU was there. Several nurses from the surgical floor were there, some of whom had been the people who'd stopped sitting near Emily at the nursing station and who were now sitting in chairs in a conference room watching something that was requiring them to hold two realities simultaneously, the one they'd accepted and the one that had been true all along. General Krause was there in person, which Whitmore had not told her in advance. He was in full dress uniform, and he stood at the front of the room with the ease of someone who had been in formal settings long enough to be genuinely comfortable in them. And when he spoke, he did not use the language of ceremony for its own sake. He said, "The commendation I'm presenting today was earned 4 years ago in conditions that cannot be fully described in a public setting. What can be said is that Sergeant Emily Carter's medical intervention during the Delvara operational period prevented the deaths of 4 military personnel and enabled the safe extraction of a 5-person team from a compromised position. She performed surgery under fire, in the dark, with equipment that was not designed for what she used it for, and every one of the people she treated survived." He paused. The conference room was very quiet. She was recommended for this commendation immediately following the operation. The formal presentation was delayed for operational security reasons. Those reasons no longer apply. He looked at Emily. She walked to the front of the room. She stood in front of General Krauss, and she did not feel what she'd expected to feel. She didn't feel vindicated, exactly, or triumphant, which were the clean emotions that moments like this were supposed to produce. What she felt was more complicated than that. She felt the weight of the 4 years since the operation. She felt the weight of the 3 years at North Valley. She felt the specific human exhaustion of having carried something alone for a long time and being, finally, in a room full of people who were holding some of it with her. She felt like herself. That was the simplest and most accurate version of it. Krauss pinned the commendation and stepped back. He saluted. She returned it. The room applauded. It was not a formal ceremonial applause. It was the real kind. The kind where you could hear individual people in it, where Voss's was slower and more careful because of his ribs, and where Pharaoh's was slightly too enthusiastic and slightly too fast, and where Marsh's was the kind of applause that had the quality of an apology built into it. Emily stood at the front of the room and let it be what it was. She didn't deflect it. She didn't qualify it. She had spent too much of her professional life declining to take up the space she'd earned, and she was done making that particular mistake. She went to see Reed once. She hadn't planned to. It wasn't a decision she made consciously so much as something she found herself doing on the afternoon before she gave the board her answer, when she was walking through the parts of the hospital she'd worked in for 3 years. Doing the things she did when she was thinking, which was move. He wasn't in the building. She knew that. His credentials had been deactivated. His office had been cleared by the compliance team. His parking space had already been reassigned. She stood outside the surgical suite that had been his primary OR and looked at the door with its porthole window and the ordinary room behind it. And she thought about what it cost to be the kind of person he'd been. Not to get caught. That was a different calculation. She meant the daily cost. The specific energy expenditure of treating the people around you as instruments rather than people, of building a professional identity on the suppression of anyone who threatened it, of waking up every morning and maintaining the version of yourself that needed other people to be smaller. That was exhausting work. She'd watched him do it for 3 years, and it had looked like power, and it had actually been a very elaborate and consuming form of fear. She didn't feel sorry for him. She didn't feel nothing either. She felt the complex, unresolvable thing that you felt when someone caused genuine harm, and you could also see the mechanism of their damage clearly enough to understand it wasn't inevitable. She turned away from the OR door and walked back toward the main corridor. Walter Price had been discharged 2 days earlier. She knew because she had checked his chart, out of nursing habit, out of the particular attachment that formed when you'd held someone's blood inside their body with your hands. His discharge note said he'd gone home in good condition with follow-up scheduled in 3 weeks. She hoped he'd told his wife the version of the story he'd decided was the right one. She gave the board her answer on a Tuesday. She accepted the clinical leadership role with conditions she'd drafted herself and presented in a document that she and Whitmore had worked on together over 2 evenings. Conditions about the scope of her authority, the reporting structure, the specific powers of the complaint review system she would be designing, and a provision that no complaint against any clinical staff member could be advanced to administrative action without her sign-off during the first 2 years of the new framework. Sol read the conditions. She conferred briefly with the 2 remaining board members who were present. She agreed to all of them. Emily signed the agreement across the boardroom table in the same building that had handed her a suspension notice 8 days earlier. The pen she used was the extra one she kept in her bag. A cheap, ordinary pen, the same kind she used to annotate charts, not different in any way from any other pen she'd used in 3 years at North Valley. The work required the same tool as the work always had. That seemed right. She called Whitmore that evening. "I'm staying," she said. "I know," he said. "Kraus told me an hour ago." "Kraus knew before I called you?" Kraus makes it his business to know things. She could hear something in his voice that wasn't quite humor, but was adjacent to it. The dry warmth of someone who had spent 40 years around people who were competent and difficult and had learned to appreciate both. "It's a good decision." "I know," she said. "The DHA offer stays open," he said, "if it ever stops being the right call." "I know that too." She was at the window of her apartment. She'd been home twice in 8 days, and the plant on the sill had not died, which felt like a minor operational victory. "How's Voss?" "Stable. Irritated about his activity restrictions, asking his physical therapist questions she considers above her pay grade." A pause. "He's going to be fine." "Tell him I said so." "Tell him yourself," Whitmore said. "He's been asking when you're coming back to the hospital." "I'll be there tomorrow," she said. "I start the new role officially on Monday." After she hung up, she stood at the window for a while longer. The city outside was doing what cities did, moving, lit, indifferent to any individual story inside it, carrying on the continuous project of itself without regard for the conclusions being reached in the apartments of the people who lived there. She found that steadying rather than lonely. The world's indifference was not the same as the world's absence. It was just the world being the appropriate size. On her last day as a staff nurse at North Valley Medical Center, the Monday before she transitioned to the new role, which she'd asked for specifically as a clean line of demarcation, she worked a full-floor shift on the surgical unit. She did it because she'd asked to, and Sol had looked slightly surprised but agreed, and Emily had not felt the need to explain. The explanation was that she had become a nurse because the work mattered, and the work had not stopped mattering because the circumstances had changed, and she wanted to finish that chapter in the way it had been lived, present, doing the job, accountable to the people in the beds. She checked vitals. She managed post-surgical pain protocols. She spent time with a 50-year-old man named Graham, who was recovering from an abdominal procedure and who was frightened in the specific way of a person who had never been seriously ill before and was discovering that the body was less reliable than he'd believed it to be. She sat with him for 17 minutes that were not in any protocol and not reimbursable and not particularly efficient, and she talked to him about what recovery actually looked like, not the clinical version, the human version, the version where some days were worse than the day before, and that didn't mean the direction had changed. She had a complicated relationship with the optimistic version of that speech. She gave him the honest version. "It's not linear," she said. "Nobody tells you that. They give you discharge instructions and follow-up appointments, and it sounds like a schedule you can keep, and then a bad day comes and it feels like failure. It's not failure, it's recovery." Graham looked at her. "You sound like someone who knows that from the inside." "I know a lot of things from the inside," she said. "That's one of them." Well, at the end of the shift, she changed out of her scrubs in the locker room, and she put the last of her personal items in her bag. The pen, the granola bar, the notebook. And she took down the photograph that she'd been keeping in her locker for 3 years, which was a small photo of a group of people in operational gear in a location she could not name, and she looked at it for a moment. She put it in the front pocket of the bag where she could see it when she opened the zipper. She'd been keeping it in the back. She went up to the ICU. Voss was in the chair beside his bed, the step-down room, not the ICU itself, but she still thought of it as the ICU because that was where he'd landed, doing something on a tablet that he put down when she came in without making a thing of the interruption. "Last shift," she said. "Marsh told me." He looked at her with the attention of someone who had known her in 2 very different contexts and was currently seeing both at once. "How was it?" "Good," she said. And then, because it was true and because he would know if she wasn't being honest, "Hard, but good." He nodded. "I want to say something," he said. "Okay." "You made the right call. Leaving the service, coming here, doing what you did here." He held her gaze. "I know it didn't feel like it was going well, but the choice itself, taking what you knew and bringing it somewhere it didn't usually get to go, that mattered before any of this happened. He paused. You kept people alive here, before me, before any of the investigation, just by showing up and doing the work. She stood in the doorway of his room and didn't say anything for a moment. Walter Price, she said finally. Yes. And Dorothea Baines on the medical floor, who was scared and alone and needed someone to sit with her. Yes. And Pharaoh, who is going to be a good physician because he pays attention and doesn't assume he already knows the answer. Yes, Voss said. She looked at the window. The afternoon light was clear, not gray, not struggling, actual clear afternoon light, the kind that came in November when the clouds broke and the sun was low and everything it hit had an edge. Okay, she said. He almost smiled. That's not a conclusion. No, she said. It's a start. She left him there, sitting in his chair, recovering at the pace that bodies recovered, which was slower than anyone preferred and faster than it sometimes felt from the inside. She walked out of the step-down unit and down the corridor and into the elevator and down to the lobby, which was doing what the lobby always did, absorbing and redirecting the continuous flow of people who came to this building frightened or exhausted or hopeful or all three at once, who passed through it carrying the full weight of whatever had brought them there, who were in the middle of the worst or most frightening or most uncertain chapters of their lives. She had spent 3 years walking through this lobby without being seen. Not invisible. She'd been visible. She'd been present. She'd done the work every single day. But the scene that she'd been denied was the kind that acknowledged what the work actually was and what it took and who was doing it. The kind that said, we know what you're carrying and we understand what it cost, and it was worth it. She crossed the lobby. She pushed through the main entrance. The afternoon light was exactly what it had looked like from Voss's window. Clear and low and edged, the November version of generosity, not warm but honest. She stood on the sidewalk outside North Valley Medical Center, and she was not the same person who had stood here 8 days ago in the gray afternoon with a suspension notice in her bag and a phone call she hadn't expected. She was not better. She was not fixed. She was tired in multiple layers, and she had things to do that were going to be hard. And the investigation was still running, and the new role started Monday. And Voss had 4 more weeks of recovery ahead of him, and somewhere in a federal archive there was a report she had filed years ago that had finally, through a long and circuitous and entirely non-theoretical chain of consequence, been taken somewhere. She was not the person who'd stood here 8 days ago. She was the person who had always been standing here, underneath the version that North Valley had decided to see. And the difference between those two people was not what the building had finally acknowledged. The difference was that she'd stopped waiting for the acknowledgement to make it true. She'd known what she was worth every day she'd walked through those doors. She'd known it when she was handing instruments in an OR where no one asked her opinion. She'd known it when she was sitting with frightened patients in the hours when no one was watching. She'd known it when she'd pressed her hand against a wound and held it shut through the 11 seconds of silence while everyone else figured out what had happened. The quiet ones. The ones who show up before anyone else arrives and stay after everyone else leaves. The ones who know things they aren't asked about and do work that isn't credited and carry expertise that doesn't fit the frame they've been given. They are not waiting to be discovered. They are already there, already working, already the reason the thing holds together. The world caught up to Emily Carter eventually. It always does, to people like her. It just takes longer than it should. She put the bag over her shoulder and she walked away from the building into the clear November afternoon, and she did not look back.